Hello, fall is definitely here. Mullica Hill was swamped this weekend with folks who are enjoying the Civil War reenactments and all of the great things in town. So it's wonderful to see crowds coming back and obviously safely social distance, but it still was a reinforcement that we continue to make great progress and things continue to hopefully get back to normal. I wanted to mention to you that our healthcare food service workers celebrated their honoring last week in reference to all of the things that they do. There are about 158 of them, and they actually provide 1.7 million meals a year. It also is October 16th is World Food Day, where we all think about those individuals who suffer from not having enough access to food and to having food deserts, which we know even exist in our community. It is wonderful to see our own food pharmacies where we can identify individuals who are in need of food supplements, and we link them into our own dietitian services and make sure that we can explain things to them, but also into connecting them to social services like the food banks and the Medicaid programs and all of the things that we can do to make sure that they have all the supports they need for themselves and their families. Of course, it would not be a video without talking about vaccines. I know there will be one day when I don't do that, but it's not going to be soon, unfortunately. We are continuing to make ourselves available to all of you, both for those who are still pondering getting the vaccine. We do have first and second doses available, and for those individuals who are looking for their booster shots. It's anyone 65 and older and who has immunocompromised. All essential workers are also in that category. So please make sure you do get your boosters. So as we think about different ways to share different points of view about the COVID vaccine and the importance of it, I thought it would be important to share just a quick snippet from this video that the American Association of Critical Care Nurses put out. I think it does a really good job of talking about what it's like and what it's been like for our critical care nurses on the front line, but also what it's like for the patients and their families.
Hear us out.
Hear us out.
Hear us out.
Nurses like me have seen how real this virus is.
It's killed over 600,000 Americans and counting.
It doesn't care where you live, who you associate with, or what kind of person you are.
Seeing people suffering shift after shift is heartbreaking.
Especially when you know a vaccine could have prevented it.
It has nurses exhausted.
But being deprived of sleep pales in comparison to seeing our patients deprived of oxygen.
I can't tell you how many times I've held a tablet for someone who couldn't say goodbye properly.
How many people have begged me for the vaccine from their hospital beds when it's far too late?
Now that you've heard us, can you help us?
If you haven't gotten your vaccine, will you strongly consider it?
If you have, will you make a strong case to friends and family to do the same?
Because working together isn't just the best way to get past this thing. It's the only way.
So October is also Healthy Lung Awareness Month, and obviously with COVID, we've been very focused on our respiratory conditions and making sure that we're paying attention to those things. But probably it's most important as for those individuals who are struggling to quit smoking. I want to share a story this morning of June Maloney, who was enrolled in our with our Quit Center, which obviously provides the supports people need who have addiction to cigarettes. And there is a group session that she participates in, and at 9:58, she really wasn't sure whether she wanted to click in that link or not and do that virtual session. But when she did, there she saw Tiffany Carter and Marietta Clendaniel with their smiling faces and their willingness to make sure that they knew that she was there. And it just provided such comfort that she actually took the time to write a note, and she wanted them to know that it was the knowledge that she had their full support, knowing that they would walk with her in this journey, that she would be able to finally quit after 13 years of smoking and give herself that chance. So we congratulate June for being on her journey, and we thank, of course, our tremendous team of Inspira staff who are always ready to support our patients as they move forward. I know that many of you have said to us that you see our Inspira trucks everywhere, and certainly we are well represented throughout the South, but I also just wanted to share, we had a lot going on this weekend, and our employees are always out there supporting the different events of the community. We had the Alzheimer's Walk this weekend, we had the Woodbury Parade where our EMS team was, and then there was a funny rescue farm event this week down in Mays Landing that we also supported. So I just wanted to have a quick shout out to all of our volunteers this weekend who supported everything that we were doing, but also to our EMS team who worked so hard to make sure that they are there and present with everything that they do. I also want to share with you that our EMS squads have the opportunity to be recognized for their great work by the New Jersey Office of Emergency Management Services. They are actually doing a competition on the EMS Community Health Awards. And so the more people that obviously support our teams, the better it is for this special recognition for all the hard work that they do. So again, I am so grateful that we have this time together each week, that we can share what's going on within our Inspira world and within the broader community in reference to COVID as we work together to fight this pandemic. I thank you for the continued support, and until we meet again, be well and stay safe.